Welcome, I'm Jess Gomez from Intermountain Healthcare. Today I'm joined by Dr. Benjamin Horn from the Intermountain Medical Center Heart Institute. Thank you so much for being with us.
Thank you, Jess.
And we're talking about AHA 2018 Scientific Session in Chicago. We've been traveling to many of these conferences for quite a while now. What do you look forward to most at a session like AHA?
Well, one of the things is hashtag AHA18. The social media has become a big part of our interaction at the conferences, and we find a lot of information that you can't get to every presentation that there is, and so social media helps to both see what you've missed, but then also see what's coming up and maybe change the direction that you're walking so you go to a different room. And the other is just running into colleagues from other organizations, universities where you get to collaborate and talk about collaborations and see what you can collaborate on. And it's an opportunity to interact, and I'm looking forward to that as well very much.
I know for the Intermountain Heart Institute, one of the big factors is collaboration, is looking for opportunities to collaborate with institutions, researchers, scientists, clinicians from around the country. How does that happen in practical terms? When you're there, how does somebody get a hold of you, and what are you looking for in terms of collaboration?
Well, getting a hold of me, there are a variety of ways. Come to the Intermountain booth or contact via Twitter or so forth. And then just running into colleagues, striking up conversations at the different presentations, and having something that we're doing that either a database that a colleague has or an idea that they have that we could evaluate in our electronic health records or so forth is something that we've done numerous times and can help out with the projects that we're already doing to do some validation at geographically distinct institutions or so forth where the population is different for a variety of different reasons potentially, to help us find and publish the findings from our different studies.
Now, one of the unique things that Intermountain brings to the table is this really tremendous database that is very unique. Talk about that and how it has applicability to some of the collaborative opportunities.
Well, the database is very unique with very well clinically phenotyped patient results from laboratory to clinical to interventional outcomes. And so it's something that we've been able to use for our studies and also for collaborating with others who have ideas that they want to validate. And it goes back almost 30 years that we have data, and so we have a lot of longitudinal outcomes for mortality and cardiovascular events that we can evaluate.
And the database is enormous, right? What is the size of it now?
Well, we have clinical information on hundreds of thousands of individuals, and then we have DNA for our cardiac cath lab. We have DNA on more than 30,000 individuals and plasma samples and so forth. So we can do protein and metabolomics and DNA testing, sequencing, and so forth for any number of different studies. And we have the clinical information, the comorbidities, demographics, and the clinical outcomes, the longitudinal outcomes. So it's a very powerful database.
Well, that's great. And like Dr. Horn said, there's lots of opportunities to connect with Intermountain Heart Institute. One is by coming by the exhibit hall and visiting the team of clinicians in the Intermountain Heart Institute booth. And another is contacting you on social media on Twitter. What's your Twitter handle?
It's Dr. Benjamin Horn.
Great. Well, thank you so much for joining us. We appreciate it. Have a nice day.